Thank you all for being here. It's gonna be a phenomenal night. And tonight we're gonna talk about collagen. For those who don't know me, my name is Dr. Brimhall, Dr. Brett, kind of affectionately known here at LifeVantage. And I'm thankful that you're here because there's so many people that really have not got a chance to hear and understand what collagen and activated collagen specifically could do for you. And so we're going to go start off with some stories and just here's some real people's experiences. And I want you to know that mostly all these people that are going to talk tonight have been on being activated, which is understanding that the body has these switches inside of us that if we could just turn them on, we can function like we did when we were younger. Because at the end of the day, when people come in to see a clinician, yeah, they might say they have a pain or an ache, but what's happening is those pains or aches or diagnoses are not allowing them to live the life they want to live, whether that's not being able to pick up their grandchild or whether that's to can't provide for their families or to feel like they just don't have the energies to do the thing they used to love to do. Like that's what this is about. And many people have given up hope. And you're going to hear some stories tonight that I hope it resonates with each of you and give you some ideas, some things that might give you an options. And then I'll come back and I'll talk about why I believe we're seeing what we're seeing. Because, a couple months ago, I liked collagen, thought it was good and important, but I would never recommend it because I never saw consistent results. And I want you to hear these stories, these real people and to hear what's happening in their life. So I'm going to jump right into it. So I'm excited for you guys. So when we talk, so Christine, just unmute yourself. I met Christine years ago. And I've kind of watched this journey of what she's gone through in life. And it's been super, super fun to watch the change over this last, couple months and what college has done for her. So Christine's background is she's an occupational therapist. And so her day, every day is helping work with individuals to get them back doing what they love to do. And many of them are young people. And so she has an opportunity to watch people that struggle and to be able to kind of help them. And so I'm so grateful for her knowledge and expertise that I get to send people to. But I'm excited for them to hear your story, Christine, and what this has done for you. So take it away, please.
Okay. Hi, everybody. So there are a lot of stories since we started collagen about 90 days ago. One of them being personal story for me. In 2019, so I've been activated, like Dr. Brett has said, for 6 years now. And 2019, I had my breast implants removed, and I also did a surgical lift. So some of you can imagine that would probably come with serious scars. So I was left with scarring that I really didn't care for. It's just the way my body heals. My body image definitely was changed, and I wasn't loving what I was seeing. I did everything possible. I did cold laser therapy to get them down. I did microcurrent, which actually helped a lot more and advanced the stages of my scars over the last year. You name it, every oil possible that you can imagine getting in there. And I thought I could get the best results that I got, and I was happy. You just have to, become one with it. So the last thing I expected was when I got on the collagen to see actual transformation of my scars after, what was that, 2019, 3 years ago. My scars are literally now the same color. Now they were very red. They're now the same color as my skin. So when I look in the mirror, I don't see them. Where sometimes before the 90 days of starting this collagen, they were glaring at me in the mirror some days, and it was hard to see, not every day. So this collagen had transformed the elasticity, the plumpness, the color, everything, just brought extra healing to those scar tissues that I never thought could actually be possible, because I was actually thinking of going the route of resectioning the scars. So imagine that, having spent like another, I don't know, let's just throw a number, $3,000. And I was able to get to the place that I want to be in 90 days just by activating my body with this collagen. So that was super impressive. And then the one thing that I didn't even think would make a change, my hands, I just turned 50, and my hands were like 70-year-olds. They were really thin, and I had age spots on them. I'm like, okay, well, maybe I'll go to the dermatologist and get them, get them burnt off. You know, I don't know. I don't want to have these age spots on my hand, and very like paper thin on the top of my hands. Well, in 90 days, actually, this was in 30 days. I noticed my skin was so plump on my hands, and my brown spots on my hands completely fading. They're still there slight, but I can't even see them. It's not this sore, you know, to my eye, you know, that type of thing. And not to sound vain, but it, you know, these are things we look at, right? We get really particular with ourselves as we age. So it's a beautiful thing, the elasticity, how plump my hands are. I just never thought that would be possible. The one thing I'm going to tell you is I didn't take pictures of my hands. So when you get the collagen, take pictures, every angle possible, your hands, every part of your body that you think wouldn't change, it will change. So you want those before pictures so you can see the after pictures, because I didn't get them of my hands. But if I can share one more story, Dr. Brett, my boyfriend losing the hair, balding like men do here and around the top, activating his body. We also did probably about 5 months worth of the hair care system, which had incredible results. His hair was super baby fine, and we started to see new growth coming in, and he was getting excited because you know what that's like for a man too. They don't want to lose their hair. He was super excited with just the hair care system. And then all of a sudden, launch of collagen. And of course, you know, we want to try these products. They're literally formulated so pristine, like it's amazing. So we activated with collagen 3 months ago, and his hair growth, I will put it in the group, the pictures, is unbelievable. I'm telling you, it's at least 80% of hair growth. He does not have any, like you cannot see any balding in here. So we're super excited on what these products have done. I would say just, you know, give it a try, get it into your system, see what it does, see how much better you can get, because we always think that we're at this level of health. There's so much more. You know, there's an exceptional level that we can get to our health if we just activate it and put the right things into our body. So thanks for letting me share.
Hey, thank you so much, Christine. I love that. I can't wait to see the pictures. So thank you again.
Yeah.
So I'm going to go now up to, well, I'm going to say up because they live up on the mountain for me. Go ahead. I'm going to mute yourself there, Christine. It's okay. And TJ and Erica, and they live up in the White Mountains of Arizona. And just the story of TJ and his life and how much he has changed, it blows my mind every time I hear it. But I'm excited for you to hear their story and what they've experienced, both of them, with the collagen. So we're going to let ladies go first, TJ. Okay?
Yeah, that's fine.
Erica, I can't wait. And Erica, she's an amazing dancer and dance instructor. She pours into women, young girls all the time, help inspire them. And I just love what you guys do as a couple and as individuals. I'm excited for you to share what your experience has been.
Okay, great, Dr. B, thanks. My name's Erica Scarborough. I am 42 years old. I've had 6 babies. Like Dr. B said, I'm a dancer by trade. I've been teaching for 18 years now. I've had my studio and I've absolutely loved it. But with that comes the roughness on your body. I've had 2 knee surgeries. I've torn my Achilles tendons. I have pins in both my feet. I've torn my rotator cuff twice. I've broken just about every toe, every finger, just the life of a dancer. So at 42 years old, I go to do a Grand Plie with my class and everything pops and makes funny sounds and everyone laughs. But I started this collagen about 45 days ago. I did my first 30-day set of collagen. I feel like I am a well-oiled machine now, if that makes sense. It rained a few weeks ago. I didn't feel that storm come in. And those of you that have had surgery and joint issues, when it's going to rain, you know it's going to rain. When that storm pressure comes, you can feel it in your body. And it was awesome. I didn't feel that. I looked outside and I was like, oh, look, it's raining. And I don't even know. It's great. But the next most important thing to me is I am also in stage 2 kidney failure is what the doctors have diagnosed me with. And I've just had a really rough time with my kidneys. I started passing kidney stones about 19 years ago. I've seen Mayo Clinic specialists. I've been all over and there's no rhyme or reason why I make them. My last pregnancy, my right kidney actually shut down all the way. It's been a really rough go with my kidneys. And part of that consequence is I get really tired really quickly because my kidneys don't filter. They filter all that junk out of your body all those toxins that you need. And 45 days ago when I started this, you can ask my husband, every day I needed a nap. I would get about 1 o'clock and I physically couldn't. My body could not keep up. My kidneys couldn't keep up. I would drink a ton of water, a ton of Axio, but I just couldn't. And I probably haven't had to have a nap in the last 3 weeks. Something about this collagen is changing my internal function. And I can't explain it. Dr. B probably can explain it, but all I know is it's working. And that's all I care about, is that it's working, and it's working for us. Because at 42 years old with 6 kids, I cannot give up on my family. And if that means that LifeVantage changes my system so I can be a great mom and a great grandma someday, then it's worth it. And no makeup on. It does great things for your skin too. But we love what it's doing for our joints and for my kidneys. So I'm going to turn it over to TJ now.
Thank you, Eric. That was amazing. All right, TJ.
My name is TJ Scarborough. We live in Eager. I'm 41. Just for the record, Dr. B, I know you always make fun of us having 8 kids. I wanted to do the Zoom in the kitchen, at the kitchen table. My wife wanted to do it in our bedroom, in the bed. Like, she's always trying to get me in the bed. Oh. Just, it's not me, it's her. Not me, just
go on.
Anyway. If Erica didn't have the surgery, I did. I've had 4 different back surgeries. I have 2 artificial discs, 2 rods, and 11 screws in my L4, L5, and S1. I've had surgery on my left ankle. I've had 4 surgeries on my meniscus, on my left knee, and I've had 1 on my shoulder. I've been horrible, physically, mentally, not being able to provide for a family, or being in that confined to a chair, or even just knowing that you're addicted to opioids. It's a hard deal to deal with. My last surgery, I think I'm recovering really well from it. I didn't have to take as many pain pills as I thought I was going to have to take. I was able to get off of them easier and quicker. I've been activated for now 4 years, but once I started taking this collagen, that's what really kind of started changing everything for me. It's like I went into overdrive. I used to work at a power plant before I busted up my back, and we used to have PMs, preventative maintenance, and we have to go around and grease everything that need to be greased. And that's kind of what it feels like. My arthritis in my fingers, arthritis in my back, the pain in my back, the stabbing, the dullness. Yesterday, I was out working horses, and I noticed my round pen needed to be worked. I was able to shovel. Man, I was out there for hours shoveling. I was sore. I was tired. Today, I was able to get up, no pain. I'm going again. I get sore and I get tired, but I mean, you want to come work with me, and I'll wear you out. Like, I'm not. You'll get sore and tired. On Monday, I'm fixing to go work an outage in Utah. We're working 712s. I'm welding boiler tubes, crawling into tight spaces. I got all my tools I got to carry. Like, you want to come work? Let's go work. This has allowed me to be able to work. I love to work. I love to get out and work with my hands. I love to do physical labor. It's something I enjoy doing. This has allowed me to be able to go from the recliner, from the bed, not being able to get up, mentally just drained, physically drained. Yeah, we're going to go work. So this has changed my life. I know it's changed my wife's life. I've seen her. I've seen when she's been down and out. She's seen me when I've been down and out. This has definitely changed her life. And just like, I think, Dr. B, you said it, they sold over 400% of what they thought they were going to sell. That's saying something. That says something right there. If that doesn't say it to you, then I don't know what will. Like, I know this works. Yeah. I'm on board. We're rocking and rolling.
Yeah, TJ and Erica, you guys are both amazing. Way too young to have that many surgeries. But just excited that you can do things. And by the way, we're excited you feel really good and can take care of all those kids because Eric, I don't think you should leave them all alone with TJ. That'd be a bad idea. So thank you guys a bunch. Appreciate you a ton. And so I'm going to go to one more. And I want you guys to hear from the one that's kind of helped line this up with is Eileen. She kind of keeps me straight on the technology side of things. And many of you can have heard her story, but I've worked with Eileen literally since 2003. I began practice in 2000. That gives you a little perspective. And Eileen, I know that the activation and Nrf2 and Protandim is really life-changing for you. But I'd love to kind of share what you've seen this last little bit with the collagen, because I keep thinking there's really no way she can get better than she is. But literally, we're seeing your body continue to do things, even though chronologically you're getting older, like biologically, it's like you're getting younger.
Yeah, it's very exciting for me too. So hi everyone, I'm Eileen. For those of you who don't know my story, real brief, for 25 years I've had a diagnosis that has left me with some handicaps actually. But for 15 years I tried everything possible. Dr. B kept me going with supplements and with his therapies and with many things that I was doing, but I never had potential or hope that I would have a quality of life again. I was one task I would do one task and lay down. And like I said, I have sustained some handicaps of disabilities with my body, of the damage from the disease process. And I knew I was going to walk with a limp. I knew I was going to be in pain all the time because my body's out of alignment all the time. And when I started activation, I was blown away that it actually worked for me. And then to find out it worked for other people was like, wow, this is amazing. And I found myself being able to live my best life. And like Dr. B said, for me to go one step further, I would have been thrilled with the quality of life I had. But where I am today, which is only since June, it's very humbling for one thing, but it's so exciting because I am able to use my body and move my leg and move my body the way that I did not know was going to be possible again. And just a quick thing, I went to the eye doctor last week, and due to the disease process, I am blind in my right eye, and my left eye has lost color rods, and I have cataracts that are drug induced. My prescription has improved 2 points or whatever that is. That is not possible for someone who's been through what I have been through. It's just so exciting, and I am being able to exercise now. I find my mood better. I just didn't know all of that was going to be possible with where I've been. And so if you want to touch on some other things, that's what I have to share, but thank you.
Hey, Eileen, thank you so much for sharing your story and being a big part of my experience with Life Energy, and really one of my best teachers. Some by difficulties, but helping me push me harder to try to find more solutions. And so I appreciate you being on here. So guys, what I want to do is I want to kind of talk a little bit about the why and what's really going on with all this. Because what you've heard, and I'm going to kind of recap, are the different stories. We're seeing changes in skin. We're seeing changes in the way that organs function, changes in hydration. You're hearing about muscle strength changes. You're hearing about eyesight changes. Like, so how is that? And the way TJ put it, greasing the joints up, right? So how is that possible with the collagen? Like how is that physically possible? Well, what I want to do, I'm going to kind of share a quick slide with you, just so you can kind of see get a little perspective on why I believe this is what it is. All right, so guys, this right here, actually, let me stop. That's not the one I wanted to share. Silly me. Let me try one more here. It is actually, you know what? We'll use that one. Since you guys, I can see it. I know this might be a little hard to see, but there's different types of collagen, right? And so just based on collagen is the building blocks of a ton of different tissues in our body. And I want you to think of it as like the Legos of your body. But there are different types, 4 types, and they make up skin, hair, nails, bones, cartilage, ligaments, a lot of the internal structures of the blood vessels and the organs, right? So all these different things collagen does. So without that infrastructure, like literally stuff can't sit where it's supposed to sit. And so you have to have that. So anything that stretches has collagen in it, right? And so what I love is this slide right here, because it kind of proves the point. This individual, she's been taking collagen for years, right? 2 years of a collagen, but after 90 days on an active liquid collagen, the changes in her body were drastic. So what you're hearing these stories of individuals like tonight of TJ's and Eric and Christine's, and I love Christine's story because like she literally, and just like Eileen, like she's been searching for a year to try to find solutions and going way above and beyond what even normal would be. Yet in a short period of time, when the body was able to get collagen in a way that could be absorbed and with all the right components and activated, the body could do what it's designed to do, right? So the magic is actually in the body and inside the cell. But what LifeVantage has done is they said, hey, based upon, we understand the assembly line or the gene that controls collagen production. So let's find out how to activate that gene to turn the assembly line on. And then let's give the body the components that it needs in a super absorbable fashion. So the collagen that LifeVantage makes, it is called activated collagen because it has red chemo in it. And that's the light switch that turned on the production of the collagen formation. And whether that collagen's in the skin or in the hair or in the nails or in the muscles or in the joints, right? All these places have collagen assembly lines. And so when those light switches turn on, and then you give the body a collagen it can absorb. So this collagen, it's a marine collagen peptide. What that means is this protein, which is what collagen is, it's a protein, is made up of a bunch of different Legos called peptides. And if the peptides are too big, the body can't absorb them or can even react to them and have an allergy to them. So they're little tiny particles of peptides, so your body can absorb it, which is huge, doesn't react to it, and then can be utilized because there's 10 different of those peptides. It can be used in all these different 4 types of collagen that are in our body, depending on where the body wants it most. Like in all of us, right, we think, well, we want it here, right? I want it in my hands or my skin. But other people, like, they literally want it in their joints or the ligaments. Well, the cool thing about the body, you don't have to tell it where it needs it. It knows where it wants it. All right. But if you, number one, don't have it, or it's not activated, or it can't be absorbed, then you're not going to get the results that you could. And that's super, super important. And what I love about each of these individual stories is we've heard things about how their bodies function better and how they look better. And I heard multiple people say that they just felt like they're greased up, more lubricated, or they had more spring in the step, right? Well, a lot of it has to do with hydration. So when you see somebody's skin that looks younger, it's hydrated. And so here, I want to kind of touch on this point a little bit. So collagen, think of it all this elastic, stretchy stuff in your skin. So if you don't have the right components of collagen in the right shape, it can't hold water. Like it cannot hold water. If it cannot hold water, it cannot hydrate your tissues. So let's just say that's an organ, right? And that organ's responsible for fluid retention. And then all of a sudden it can hydrate better. It can be more efficient in eliminating the stuff that needs to be eliminated. Or if it's your skin, right, and it has age spots on it, and it can be hydrated, now the body can then use that hydration to remove that stuff from it. Or if it's an eyeball, right, that's made up of a lot of collagen, and it can hold the molecules differently, well, then your prescription possibly changed. Like I wouldn't have guessed that would have happened with you, Eileen, but because the shape of the eyeball has a lot to do with the stretchability of it and the hydration of it, somehow your body knew that it needed help. And once it had what it needed, it was able to adapt and make those changes. So what's been fascinating about this collagen, I really want to just kind of end on this point, is that your body has to have collagen every day to continually repair from just living. Like it has to. Like if you're not eating collagen-rich foods, then you aren't having the collagen you need. And so some of the frustrations you might be having in your health could be a result of a lack of collagen. And sometimes it's not from a lack of you taking collagen like this lady was, And the lady on the right, you can kind of see there, this is a good family friend of mine for years. She's had such thin hair for literally probably 30 plus years. You can see her scalp. You can see the new hair growth that's happening in her after being on the collagen in less than 60 days. And you cannot see her scalp anymore. But what's exciting to me and all these other things, she's changing, she's feeling in her body, the energy she has, the mental clarity she feels, because her body can now hydrate. If you can hydrate, you can eliminate toxicity. That's just how it works. With the solution to pollution and dilution, without an ability to actually remove that stuff through water, you're going to have issues. And so if you're not getting the results you want and you haven't tried collagen yet, please do, but give it time. And here's what I mean by that. Your body heals at different rates depending on the different organs. And I love the fact that each of you guys kind of brought this up, is that you felt certain things in a 2 to 3, 4 to 5 weeks, and you felt other things later on. So every tissue heals at different rates. Your skin is the fastest. So you might see and feel things in your skin faster than anything else, even though you might feel other things. Just understand that the repair is continuously happening. Just like what you're noticing, Eileen, with the strength and now with the eye effect, is because you've been consistently doing those things so your body can fix what it has to first and then fix what maybe you want to second. And that's exactly what the body does every single time. So I'm beyond excited to now have an activated collagen that we know works and that the body can utilize, and it's going to give us an ability to affect one of the most abundant things in our body is water and collagen. And we now have a way to get that into people's bodies, applied it with activations that turn on those gene switches, and apply it with the other technology that LifeVantage has. So guys, get back to the people that invited you to this, get your question answered, get started on the collagen, give it time, a ton more research coming. And I look forward to seeing you guys in the future. Thanks again, Eileen, for doing this. And you guys have a phenomenal night. Bye, guys. Thanks again, Erica, TJ, Christine.